Other non-pharmacologic therapies available are focused on reducing the patient's risk of developing a yeast infection. So this might be something that the patient can employ after their infection's healed. Diet plays a role. It's recommended that patients consume yogurt containing live cultures. Again, this is to help balance the vaginal bacterial ecosystem. And also, patients should be recommended to reduce the intake of refined sugars, i.e., this is less food for the bacteria. Understanding what medications increase the risk of infection is important. However, it's important to note we can't always avoid using antibiotics or other agents, but it's important to make sure that if a patient is started on an antibiotic, that we counsel the patient for this risk. There are also some over-the-counter products that are available to help manage the symptoms of infection, such as Vagisil, Summer's Eve, or Yeast Guard. These are great for symptom management, and patients will choose these based on patient preference. They come as a lot of different formulations, washes, wipes. However, it's important to make sure the patient understands these aren't going to cure the infection. They will just mask the symptoms, and it's important that patients do have a treatment agent on board. Next, we'll move on to talk about bacterial vaginosis. This is the most common vaginal infection for women. It's a result of an overgrowth of bacteria in the vagina. Ultimately, this ecosystem gets disrupted and there's an overgrowth of bad bacteria. The most common pathogens include Gardnerella vaginalis, Mycoplasma hominis, Bacteroides species, and Mobiculus species. For bacterial vaginosis, it's important to be able to identify risk factors, which include multiple sex partners or a new sex partner, smoking, douching, or any of the intrauterine devices, or if you're receiving oral sex. For this infection, patients will present with thin or watery, off-white, or possibly discolored foamy discharge. The key identifier of this infection is the unpleasant or fishy odor that's present. This odor may increase after sexual intercourse or with menses. Objective findings for this infection include an elevated vaginal pH greater than 4.5 and microscopy demonstrating the presence of clue cells, or cells surrounded with bacteria. Again, the vaginal pH and the microscopy are two classic findings of bacterial vaginosis. For the management, it is recommended that patients seek out prescription therapy. This is why it's really important to be able to distinguish between the different types of infections, because we want to make sure that we are able to appropriately identify patients who will require further medical evaluation. The medications used for bacterial vaginosis are listed there. The most common agents include metronidazole, 500 milligrams twice a day for 7 days, and the metronidazole intravaginal gel used for 5 days. The oral agent is somewhat preferred as it's more convenient for patient administration. However, with all oral products, there is more of a risk for systemic side effects. Oral clindamycin is also available if patients are unable to tolerate metronidazole. Tinidazole is also another agent, but this is recommended last line if patients are unable to use metronidazole or clindamycin. Next, we'll move on to trichomoniasis. This infection is caused by the pathogen Trichomoniasis vaginalis, which is a flagellated protozoa. This infection is spread via semen and vaginal secretions, and is usually spread during unprotected sex. Risk factors for trichomoniasis include non-barrier protected sex, multiple or new sex partners, and can be associated with other sexually transmitted diseases. Patients will typically present with symptoms of copious, malodorous, yellow-green, frothy discharge, pruritus, vaginal irritation, and dysuria. Upon vaginal examination, strawberry spots on the vagina or cervix may be seen, as you can see in the picture there. This infection is more common in women compared to men, and most men that are infected are asymptomatic. Since most infected men are asymptomatic, they can unfortunately act as a reservoir for infection and can unknowingly continue to spread the infection. Diagnostic evaluation reveals an elevated pH from in the range of 5 to 7.5. In looking at a vaginal culture, white blood cells may also be present. The most reliable method of diagnosis is a wet mount examination of the vaginal discharge. From this wet mount, characteristic pear-shaped flagellating organisms will be observed. Patients may also undergo a pap smear. However, this is less sensitive to the detection of infection as compared to the wet mount. Like bacterial vaginosis, the management of trichomoniasis is referral for further evaluation and prescription therapy. Unique to trichomoniasis is the need to treat the sexual partner, and as I said before, men can act as a reservoir for infection. While both partners are undergoing treatment, it's important to abstain from sex until the treatment is complete. In the table, I have listed the recommended treatments for patients. For patients who are asymptomatic and likely their first infection, the recommended treatment is high-dose metronidazole, 2 grams as a single dose. You can also use the smaller dose, the 500 milligrams, twice a day for 7 days. Tinidazole is also another option, although I have not seen this used option, as metronidazole is usually available. For patients with recurrent infection, it's recommended to use the longer dose of metronidazole, 500 milligrams, twice a day for 7 days. For patients who are pregnant, it's recommended to use metronidazole high dose. Tinidazole is not recommended in pregnant patients due to limited data on safety and efficacy. So finally, for this last slide, I included a table to summarize the key points for each infection. It's important that you're able to distinguish between each infection and be able to recommend treatments based on infection and whether or not the patient is going to need referral for further evaluation. I hope you've enjoyed this presentation and feel more comfortable managing these vaginal infections. I would again encourage you to take a look at the recommended readings in order to have a full understanding of the management of these infections prior to class. Thank you.